My name is Anita Patel. I am an associate professor of pediatrics, a double board certified pediatrician and pediatric critical care attending, researcher, and most importantly, a mother of two. I have dedicated my life to improving the health of our nation's children through clinical care and pediatric research. I am here today because we are witnessing a healthcare crisis unfold in slow motion, and we have the power to stop it. The numbers defining this crisis are terrifying. $1 trillion in healthcare cuts, 22 million people facing crushing premium hikes, and millions at risk of losing their health insurance, but numbers do not tell the full story. I want to tell you how this crisis will affect the lives and families, specifically the lives and families of the children I treat. Over the past 15 years in pediatrics and pediatric critical care medicine, I have seen firsthand what happens when children lose access to health care. I have intubated teenagers in diabetic comas because they had to ration their insulin that their families could not afford. I have battled uncontrolled seizures in the ICU, which can cause permanent brain damage because parents had to choose between their child's seizure medications and paying their rent. I have held the hand of a mother whose daughter's treatable asthma became a life-threatening crisis that killed her because they couldn't afford albuterol. These stories are both tragic and tragically common. When healthcare costs become unbearable, life-saving EpiPens do not get refilled. A child's sinus infection turns into meningitis. And a ruptured appendicitis leads to septic shock from delayed care. In medicine, we take an oath. First, do no harm. Right now, inaction is causing harm. And the children I have dedicated my life to protecting will bear the consequences. Every day I go to work, I see the absolute best of what our healthcare system can do. I see brilliant doctors and nurses performing miracles. I see children who survive against impossible odds. But I also see the worst consequences of policy choices that force families to choose between medical care for their children and other necessities. I am here to warn you, Congress's inaction is about to unleash an avalanche of suffering on our nation's children.